Perfect. Hello, everyone. I am Dr. Tara Calhoun. I am a pediatric hospitalist at Cincinnati Children's. Welcome to this wonderful panel, and I will let Helene McKinney kind of introduce it. This was her masterpiece, so I'll let you go, and then we'll go from there.
Thank you. I'll be very brief. I'm Helena McKinney with the Health Collaborative, and we do a number of different things in the healthcare space, especially in workforce. So you may know me from some of our programs, such as our TAP Health program, which is a summer program for students who are interested in healthcare careers, as well as some of the other events and projects we put on. So I'll drop our website in the chat, and then feel free to reach out if you have any questions. I'm going to turn it back over Dr. Calhoun and turn my camera off, but I will be moderating the chat if you have any questions. Thank you for being here, all of you.
Thank you so much, Ms. McKinney, and thank the Health Collaborative for getting us all together. I will be your moderator for tonight. And I just want to again say thank you all for coming. Looking at the list that have signed up, it's a great group of students from all different areas of Cincinnati. So we welcome you. I do have a few questions already jotted down that were submitted and some that I added, but please feel free to add questions to the chat. I'll be checking the chat, and so will Miss McKinney. So we are going to start with introduction of our panelists. I'll give them a few minutes to say their field, where they're from, and anything else that they want to add that they feel like it's important to know to start off. Nurse Practitioner Wells, would you like to get started?
Sure. Good evening, everyone. My name is Sonya Wells, a board certified nurse practitioner. Um, Currently working in primary care and aesthetics. And then I have my own consulting firm where I work with individuals and organizations, basically by providing different strategies to live a healthier lifestyle. So happy to be here. Thanks for having me.
Thank you. Ms. Soto, would you like to go next?
Yes. Hello, everybody. My name is Sandra Soto. I am from Puerto Rico. I am currently the laboratory director of operations for the Christ Hospital, and I'm excited to have all of you here today. Thank you.
Thank you. Dr. Collins, would you like to go next, please?
Sure. Hello, everyone. I'm Dr. Armika Collins. I am a board certified family medicine doctor doing a year of training right now in addiction medicine at Wright State. And I'm actually originally from Cincinnati, graduated from Hughes. I feel like I got to say that because everybody wants to know about the high school if you're from here, right? So I went to Hughes, and yeah, just happy to also be here. And that's me.
Thank you, Dr. Collins. Dr. Llambi, would you like to go next?
Sure. Dr. Lenny Llambi. I am a pharmacist with St. Elizabeth Physicians. Um, so since I grew up in Cincinnati too, went to Covington Latin for high school, Xavier University for undergrad, and then graduated from UC College of Pharmacy. Um, and at St. Elizabeth Physicians, I have a slightly different role than what you think of for pharmacists. So at St. Elizabeth Physicians, we do not, as we say in the pharmacy biz, count, pour, lick, or stick. We don't actually dispense any medications. We actually help the physicians manage complex patients and their medications. I do a little moonlighting for Kroger Pharmacy. So if anybody has any questions about your, traditional dispensing pharmacy, definitely have a foot in the door there. And then I also am adjunct faculty at the UC College of Pharmacy.
Thank you so much.
Yeah.
Okay, we will start with the first question. And I'll just go around and call you all to answer each question, but we can keep doing it in the same order, if that's okay. That way everybody kind of knows. So first question is, how did it feel as a minority going through your particular field? Nurse Practitioner Wells, if you want to start us off.
Yeah, so it was interesting going through the field. I had been in nursing for a very long time from the beginning. Graduated from high school, went straight to nursing, straight to college, and um, became a nurse pretty early on when I was like 20 years old. So it was an interesting perspective because most of the time, the coworkers that I worked with, they were either older than me, so no one wanted to listen to me, or either they were around my same age but wasn't quite a nurse yet. So it definitely had its challenges. I also think that it groomed me well to be the nurse practitioner that I am today.
Did you at any point feel like you were an outcast in your field?
Absolutely. Being one of the younger nurses at 20 years old definitely felt like an outcast. And then when I became a registered nurse, getting into some spaces that didn't often have nurses of color was an interesting space to be in. So, yeah.
Thank you. Ms. Soto, I'm going to pass the question to you.
Yes, so I am a medical technologist and I work in the laboratory science. Already the laboratory career have their challenges. Not everybody knows that there is a career path for the laboratory. Usually many students want to contribute to the patient's well-being and taking care of the patients, but they don't really want to be in front of patients. So this is a career that definitely people that wants to be part of the healthcare system and help others. It is a great avenue as a career. In terms of the challenge, yes, so it's already the first challenge to trying to find this career path. And then second, from being a Hispanic, especially for me, it was difficult in the terms that I had to move to another country. I had to learn the language. I had to go back to school. So there are many, I won't say obstacles, but many situations that you have to overcome to be where it is. But there's always at the end a sense of rewarding, that even though you have those challenges and sometimes feel like you do not belong, we all belong to somewhere. So there are challenges, but they are rewarding. It's all rewarding at the end.
Thank you. And I'll repeat the question just in case anybody else joined. How did it feel as a minority going through your field? And did you feel like an outcast at any point? Dr. Collins?
Yeah, so I would say yes and no to the question. So first starting off, of course, like I mentioned, I went to Hughes. So it's a predominantly Black school. So I was there and I was just like, okay, thriving, with students that look like me. And then I went to Ohio State for undergrad. And I would say that was the first experience where I had a true like culture shock. I was like, okay, I am in this class with literally 300 other students. And I was like one of a couple of students of color. And then if there were other like Black students in there at all, then sometimes I was like the only student. So that was very isolating at times, especially just trying to make connections, with other students. So to kind of help combat that, I would go to like the African American like center that we had on campus. So that was kind of helpful there. And then I will say when I got to medical school, it was isolating at times and then not so much at other times. So the first 2 years in medical school, you're just kind of learning like the actual medical information. So you're primarily in a classroom. I had my really close group of friends. It was like 5 of us. That were all Black women. And so we all got together like regularly. We studied together. So that one wasn't as isolating. And then I felt like my classmates were a little more, my non-Black classmates were a little more accepting. So that wasn't bad. But then third and fourth year, when we do what we call like our clinical year, so you actually go into the hospital, I felt like isolated again because I would be in a lot of situations where I was the only minority, sometimes the only female, sometimes the only Black female. So I would be like, okay, looking around, just trying to find, as I say, like my people. And so that was a little hard. And some of it I felt like I did experience like blatant like racism. And so I would talk to my mentors about it, talk to some of my other friends that were in other sites, like clinical sites, and just ask them like, hey, how are you navigating these spaces? And so that was also like really helpful for me. But I think I just had to kind of remember my why, like why I'm here, and knowing that like Miss Soto said, like we belong, So I like reminded myself, like, okay, even if I do look different than everyone else here, like I'm supposed to be here. So it's gonna help me.
Thank you. Dr. Yambia, I will put it over to you.
Um, so for me, so my family's from Cuba. I grew up in the northern Kentucky area. So I've always been, I always joke that I love to cook. I grew up in a Cuban household where we had two older Cuban relatives. So Spanish is my first language, basically ate Cuban food every day of my life. I always joke that I love to cook, and I always offer to cook Thanksgiving because to me, cooking mac and cheese and mashed potatoes is cooking ethnic food. Because that's not what, that's not a typical Cuban dish. But so I would say I was actually, I didn't really, I grew up kind of being the Cuban kid. So I grew up being sort of the outsider. Not that I necessarily experienced any bad discrimination. Experienced some, of course, but I would say, but the most interesting thing is that so I grew up in a family that had a small business, which means my first job was that small business. And so I hear this a lot from a lot of first generation kids that, oh, my family has a family business. So I'm kind of expected to work in that family business. And that was kind of the case for me, is that I was being groomed to take over the family business. And I just did not really have a passion for it. And it took me a while. So pharmacy is not my first career. I will say that was something slightly different for me, is that I did not get th again, not that I was like excluded from society, but like you're kind of in an isolated group. You've got sort of your career future set forward for you by your parents. And so it actually took me a while to figure out that, oh, hey, I could be a healthcare professional, and pharmacy actually seems right up my alley. But by the time that I went to pharmacy school, UC was super supportive, was very, um, they just immediately saw, oh man, here's a bilingual student who will be an awesome piece of the healthcare system that can, reach out to that patient population. And then I actually did my residency through Kroger Health, so Kroger Pharmacy. My first job was with Kroger Health, and even Kroger was super supportive, and they identified me as like, hey, here's a resource. And so I actually kind of made my way up through management in Kroger Pharmacy. And when that first store opened up with manager's position that had a high Hispanic population, they were like, Lenny's the guy. Let's put him in there. And Pat Ako, who I don't know if she's joined the meeting, but she's the one who put me up to volunteering for this. She was super supportive as well, and just was always looking out for those opportunities to get me in front of those patient populations that could benefit from Spanish speakers. So you know, I came along to pharmacy later on in life, but I felt like the two organizations, and St. Elizabeth Physicians has been the same, not to say that it hasn't, but those first two organizations that helped me along my way were super supportive. And I feel like they saw my ethnicity, my bilingual abilities as an asset. So that was super refreshing and awesome, and helped me a lot.
Thank you. Thank you
Yeah.
all. Another, and I guess I will just briefly go. I'm trying not to talk as much. But I really agree with everything that everyone else is saying. I think Dr. Collins and I, not that African American women, we all have different experiences in medicine, but I would say mine is very similar. I am originally from Louisiana. So probably a little bit different in that in my medical school class, out of 118, there were two African Americans. It started off with three, and I was the only female. The other female actually failed out of school. And so at times it did feel isolating, but I will kind of echo, sometimes you have to actually find friends, find allies, and people that don't look like you, but that are also very helpful and very supportive of what you do. And so, yeah, it was interesting going through medical school. A lot better when you have that cohort, the first and second years. I agree, the third and fourth years, when you start to get around patients and families, things can be a little bit different because you're working more with the community, but it's kind of what we face now. So yeah. All right. Next question I have is, actually, I kind of want to go through and have the panelists describe what a day in your life looks like, to kind of help everyone see how even diverse our panel is from what we do on a day-to-day basis. So I'll start with you again, Nurse Practitioner Wells. What does a regular day in your life look like?
So a regular day in my life, let's see, I wake up at 5:30. I let my dog out. I get ready. I get to work typically by 7 o'clock. I see primary care patients as well as women's health patients. Um, every half an hour, sometimes do some administrative work, check some labs, return some phone calls, throw in some telehealth visits and some video visits. And then I do that till about 4 o'clock. And then I leave there and I drive to my office of my consulting firm and I work on whatever project that I have going on with an organization or individual. And then I go work out at my small boutique gym downtown. And then I'm home by about 9:30. And I do it all again the next day. But maybe sometimes the next day I may go to the medical spa and I may be working in that capacity that day.
Either way, sounds like a long day. All right, thank you. Miss Soto, how about your day? Oh, wait, you're still on mute.
Similar to her, I wake up almost at the same time, 5:30. I actually work out really early at 4 because it's hard to get at the end of the day. But the workout is more about releasing stress than really working out to lose weight. But I work out, I then have breakfast, come to work. So I'm usually at work between 7:30 because I am the director of the lab. Then my functions are more about lab processes or if we have an inspection in the hospital, I participate in that, making sure that the team feels supported. And I continue with a lot of meetings during the day and usually leave the office about 5:30 or 6. And then I try to decompress after that. But in terms of the staffing related to the lab, if there are different stages in the how do you get to the laboratory career. You can start as a phlebotomist, and that is a certificate. And the phlebotomists start very early in the morning. They collect the patients, are the ones that collect the blood specimens, and they're walking a lot all day collecting those specimens. And then In terms of the testing area, we have medical laboratory technicians that these ones have a 2-year degree. And then so once the specimens are collected, those technologies are working on the instruments or working on their microscopes, and then performing and releasing testing. And then we have the 4 years degree that they do a little bit more advanced testing. So their typical day, most of the time we have 3 shifts. One maybe start at 6 o'clock in the morning, the other one start at 2, and the other one start at 8 o'clock. So most of the time, if it's in the hospital, it's a 24/7. So that's usually between how it's a little bit about their staffing and the career.
Thank you. Dr. Collins?
All right. So mine is kind of loaded because I'm like still in training with this addiction medicine. As you guys know, we go to a bunch of different places. So we're in different clinics, different hospitals. I will say from the family medicine side, it looks very close to nurse practitioner wills. So I will say you covered that very well with like what we would do with like answering messages and callbacks and like seeing patients. But for addiction medicine, I'll give an example of like yesterday, I went to a kind of a rehab facility. It's a treatment facility in Middletown. So I was there starting at 8:45, but I guess to back up, I also get up sometimes between 5:30 and 6. I won't say 5:30 solid. It was at some point, but to exercise. So kind of the same deal. Just exercise either with my neighbors or like in the basement on the treadmill. But yes, I do that. And then like I said, yesterday I was in at 8:45 in the office. And again, because I'm in training, I'm like trying to look at different areas in the treatment center. So I actually went down with the addiction nurse to see like how he actually administers methadone to patients, and then also giving out some other medications for people that have substance use disorder. And so I was there with him for half of the day. And then I went upstairs and I was with one of the addiction medicine doctors where he had medical students with him. And so we just had patients come in. They kind of talked about how things were going with their treatment, change medications around. Same in the afternoon, they actually had a staff meeting where they wanted to increase and decrease, like doing different changes with patients' medications. And so we did that kind of as a staff group. So that's one day. Then on another day, I could be in the hospital. Like I've been at the VA before, and we're doing like a consultant service where we go in as an addiction medicine team for anyone that is hospitalized. They can be hospitalized for something else, but say they have they need to detox from alcohol. So then I would go in the morning, say at 7:30 or 8 o'clock, I would actually go and see the patients, kind of get an idea of how much they've been drinking most recently. Have they been in treatment before, prescribing them medications so that they can safely detox from the alcohol. And then I would go back and talk to my team, to like the supervising doctor, also known as like the attending. And then we would kind of come up with the game plan, go back and talk to the patient about the plan for the day. So those are just 2 examples of the day. But again, in training, you can be anywhere. I mean, I was in Xenia, Ohio earlier today before I came back home to Westchester to like be on an online call. So yeah, so it's kind of all over the place for me.
Thank you. All right. Dr. Llambi, you're up.
Um, so yeah, well, except for my wife's the only one who's really not a night owl. We're all night owls at our house, so we would like to wake up at 5:30. If we're up by 6, we're doing good. But usually get up 6, scramble to get all the kids out the door to their respective schools. And then my job is actually kind of nice because it's a little bit of everything. So I am manager of ambulatory care pharmacy. So I do have on Monday, I do have one clinic day. So on my clinic days, I go to a primary care office and we'll usually show up. We actually round on all of our patients in the morning. So roundings where you basically look at all the patients you have on your schedule that day, and then all the different specialties talk about, hey, this patient needs this, that patient needs that. It's actually a really cool primary care office that's trying to break the mold of how primary care is done. And then I'll either have my own appointments or maybe a provider says, hey, can you take a look at so-and-so at 3 o'clock. I think they are confused with their medications. Then on top of that, I have a list of so big focus in the United States healthcare industry right now is going after quality. So not just doing all the things to whoever wants the things done to them, but it's doing the right thing to for the right people for the right cost and getting the right outcomes. So usually I have if I don't have appointments or if I don't have anybody in office to see me that day or that the docs want me to see, I'll actually have lists of people who maybe are not on the right combination of medications. Maybe they're on too many medications, or maybe they're not on enough medications. And so I'm just calling those patients, trying to see if we can stop a med if that's warranted, maybe add a medication if that's needed. And then otherwise, on my more manager days, I'm doing everything from looking at productivity for our pharmacists, technicians. I've I'm all so St. Elizabeth Physicians, as a physicians group, it's a subsidiary of the hospital, has only really been around for like 15 years. So one of the cool things is that we're new, we're still kind of a growing company, and pharmacy is relatively new to St. Elizabeth Physicians. So one part of my job that I love is that I get to be creative and think of new ways to get pharmacy involved. So I'll attend meetings and work with students and pharmacy residents to work on new projects for team pharmacy, um, and all sorts of other fun manager activities, coaching, uh, reviewing, setting up for budgets for next year, reviewing current year budgets, all that fun stuff. Um, I will say I will put a just give a sense for, because I still have a foot in community pharmacy. So community pharmacy where you would be dispensing medications, like at a chain store like Kroger, Walgreens, CVS, or even a mom and pop pharmacy. Um, those jobs are um, you your typical day. Most pharmacies are basically open 9 to 8 anymore. So usually you are going to be working anywhere from an 8 to 12 hour shift. So you kind of come in or close the pharmacy. Usually a pharmacy has like three, anywhere from 2 to 4 to, I mean, I guess even more dedicated pharmacists. And so there's a weekend rotation. So as a community pharmacist, you do typically have to work everywhere from every other to every third weekend. But the nice thing about working in that setup is that even though you lose some weekends, sometimes it's actually nice to have a day off during the week, because that's when you can like go get your license or renew your plates, stuff like that that you can't really do on the weekends. And then finally, I'm just an adjunct faculty at the College of Pharmacy, so I can't tell you what the full experience is of professorship, but I'd say that's one of the nice little add-ons that I have in my career. I actually have a couple of electives that I'm in charge of. So it's usually once a week. I've been doing them long enough that I've got all the coursework set up. I just have to, in the weeks leading up to the course, I just have to refresh the material, make sure everything's up to date. And then it's just a matter of going in, giving the lecture, grading the exams. I will say, since we got students on the line, be nice to your teachers, especially when you're writing short answers. Those are tough to grade. Um, but yeah, got a little bit of everything going on. Once I'm done with my day, though, I go back home, wrangle kids with homework. I've recently picked up coaching my son's baseball team. We have 2 dogs. We're all burgeoning musicians at our house, so sometimes we'll have a little jam session. And then my big hobby is this is my background. I have aquariums, so I take care of my aquariums, and then go to bed and start over the next day.
Thank you.
Yeah.
Yeah, thank you. I agree, Miss McKinney. Everybody's day is very um it spans the globe, but I will say it seems like most of us do start early. Um I'll give a quick day in my life. If you guys can't tell, I love like Instagram and TikTok where people go over days in their life. So I think this was a neat question to throw out there. Um as a hospitalist, I only take care of children that are sick enough to be admitted to the hospital. So my day literally changes every week because we have three different shifts. So sometimes I can be days, evenings, overnights. So I'll give a day last week. I was on days all week. Like Nurse Practitioner Wells, I also have a dog, so it's an early rise. But during my week on the service for residents, I wake up about 4:30. On weeks like these, I don't get to work out before I go to work. But I wake up about 4:30 so I can review charts, just kind of see what patients came in overnight, because we can do that from home. Then I will walk the dog. The dog, she's a bit of an active dog, so we usually walk about a mile even in the morning. So about 5:30, we'll walk. Come home, get dressed, and then I'm at work by 6:45, 7 o'clock. And then I start going more in depth with charts. I'll get breakfast and then start going more in depth with charts, looking at labs, looking at how sick a patient is. I check in with the residents to see if there's anything I need to do immediately before we start rounding. We start rounding at 8 o'clock. And someone talked a little bit about rounding. So we'll round. It's usually a group of theirs. So I'm the attending, which Dr. Collins kind of mentioned. So I'm the supervising doctor, but we'll usually have one senior resident and anywhere between 3 to 4 interns. And we also have a pharmacist that rounds with us as well. And sometimes we'll have and the interns can be one this week was actually a family medicine doctor, so pulling everybody in. And we do that sometimes in my line of work. I also do work. We have nurse practitioners that work with us as well in hospital medicine, but last week I did not. It was residents only. So we round. If we're being really good, it's usually from 8 to 11:30. So from 8 to 11:30, we are on our feet rounding at each patient's room. Last week was a little bit of a light week, so our team only had about 14 patients a day. But the patients change. So we go to every room, we talk about how the patient is doing, what we're treating, what medicines we need to give them, if they're ready to be discharged, if we need to keep them. So we talk about that with the parents and with the patient if they're old enough to speak. And then after 11:30, I go back to our supervising room and I sign notes while the residents write notes. We admit new patients. So the patients are coming from the emergency room. They're coming from their doctor's offices if they're sick enough to be admitted to the hospital. So they come in, we admit those new patients. I see those. I talk about whether I agree with it, like with the residents. Um, so we go through that. I sign out to the next doctor that comes on at 4 p.m., anywhere between 4 and 4:30. So sign out. I usually go home to finish my notes. And Dr. Collins, I actually live in Westchester too. So I drive back home to Westchester. So I probably get back home about 5 o'clock, walk the dog again, eat a little dinner, and then I finish up my notes. So I'm usually finished with notes about 7:30 and then start getting ready for bed to do it all over again. So that's my day. But today was different. I didn't have to go in because I did an evening shift yesterday, so into last night. So today was kind of my off day, if you will. So every day is different. But it's so neat to hear everybody's day on the panel. And it sounds like we're all taking care of ourselves in some form of self-care, whether it be with music or or working out. And so I love it. I love it. Okay, so leading into the next question, and again, anybody who's listening, please feel free to put questions in the chat. I can keep going through some that were already submitted and just some that I'm thinking of as we go along. So one of the questions, another question that was submitted is, how do you stay motivated? How do you stay motivated? Dr. Wells, I'm sorry, Nurse Practitioner Wells, we'll start with you.
Let's see. So I kind of keep a running tab of all the things that I want to accomplish. And I would say I try to check in with this list quarterly. And so whatever it is, I just decide that it's going to happen. So I'm kind of strict as far as time. I set a timeline and a goal date, and I just work really, really hard to accomplish what I'm trying to do by that date, and that has seemed to work for me. Um, yeah, that seemed to work for me. My latest project was I wanted to roll out kind of like a salon suite, but for wellness professionals that were licensed. And so people kind of was like, and I'm like, no, this is a great idea. That way people can all be under one roof and have a wellness perspective and be able to collab with each other. And it was difficult, but I put a timeline on it to launch it the beginning of January. And so I launched it about January 3rd. So yeah, I just kind of really put those things out in the atmosphere and put a date on it and go for it.
That's amazing. Congratulations. Miss Soto, would you like to go next?
Yes, so to stay motivated is just continue challenge myself and continue being part of the other people's success is something that really motivates me a lot when I see an employee that has been under my management and has come from being a technology to a supervisor to a manager, director, and continue their career being in the same institution that I am or in a different institution. Um, uh, it's just pushing myself. I was part of the Cincinnati Children's Hospital for 11 years. And now I have been in the crisis for 3 months. And part of that transition was that, that I feel that it was a need for me to go to the next level. And so I am a person that is really motivated and definitely really, really open to learn and to share the knowledge that I have for the benefits of the team.
Thank you. That's great. Dr. Collins, how do you stay motivated?
Yes, I kind of alluded to it earlier, but I try to keep like my why in mind. And so one of the reasons initially I wanted to go into medicine is because I'm like, oh my God, I was so sick as a kid. I was like in the hospital all the time. Actually at Cincinnati Children's, I was there like sick with asthma growing up. And so I was just like, oh goodness, I had a amazing pediatrician, Dr. Crawford. And I was like, I want to be just like Dr. Crawford and make people feel good, make these kids happy. And so I kind of think about like doing it for like the patients and like seeing the way that their life can change. And especially in addiction medicine now, I'm seeing more and more is that how not only their lives change, but like their entire family's lives change, once they actually are being treated. It's just amazing how you can just see, people that are like, hey, I went from experiencing homelessness to, all right, now I have housing. Now I see my primary care doctor too. Now I have my kids back. I have a job. So it's just like so rewarding in that way. The other thing is I do it just because there are so many like little Armikas around here where I'm just like, all right, Dr. Crawford motivated me. And I'm just like, all right, I see that there's so many students and young kids that look up to me and they're like, oh, wait, I can do it too. And so just trying to be like that role model too for the community. And then of course, you got to love science if you're in this. I think we all love science to a certain degree. And so I'm still fascinated by some of the stuff that I learned in like medical school. And I'm like, oh wait, this is how it pieces together. Of course, we're like always learning. So
Agreed. I love science. And every day I find out something new that we're doing or that someone else is doing or the lab or pharmacy and how that connects and that is amazing. All right. Dr. Yambia, how do you stay motivated?
Um, well, I probably have the opposite problem in that I do probably too much, but that is, I would say that is everybody's always worried that I'm like doing too much, but I think that's my secret sauce is that I just don't put all my eggs in one basket. It's funny because I'm sure all of you can echo that one of the big things that's happening in healthcare right now is concern over burnout. Um, and so, and burnout's like this hard thing to describe, but it's just essentially losing purpose and um in your career and essentially just not getting any joy or satisfaction out of what you're doing professionally. And I'll say like that is whenever I see people who burn out or who are kind of suffering from burnout, the one thing that seems to be in common with all of them is that they are just so hyper focused on, it's typically their career that they're super hyper focused on. And, one other thing that I do a lot of is we actually have two full-time faculty members that work with us at St. Elizabeth Physicians from the UC College of Pharmacy. We do a lot of research. And we just, so our team actually just won an award from the American Society of Health System Pharmacists back in December. And, you know, there's so many people out there who just hyper focus on their career and like what are all the boxes I need to check for my job. And but like for me, taking a step back and going, hey, you know what? No, I've I've got a question on like how something works, is how this medication works, how this process works. Let's take a deeper dive into it and ask the, research questions, research it, publish it, and sometimes just taking a step back and like going about things like the non-standard way, and just filling your life with things other than just your hyper focused career is what really I feel like differentiates people for who get burned out versus that don't. And so like, my life is busy. It's jam packed. I have I'm overflowing. But that's the thing is that burning out is not about having like too much, avoiding too much. It's about doing things that are fulfilling and have meaning greater than just getting into the hamster wheel and running all day long. So,
Thank you.
yeah.
All right, we had a question in the chat that said, so taking a step back in college, how did you remain motivated and keep pushing? I will actually start by answering that, and it's very interesting. I distinctly remember um because in college you do have a lot of competing things, right? So I went to Louisiana State University, some may know it as LSU, in Louisiana, and I was in a sorority, did all those things, and so very easy to get distracted. I remember third my yeah junior year, I was like, Lord, if there's something else that you want me to do besides being a doctor, because this is getting hard. I had a roommate who was in like business or design, which is great. Don't get me wrong, but when I was studying, she was binge watching TV, and so I was like, if there's something else that you have for me, let me know. And he said no. And so I actually and printed out this big banner with a Bible scripture on it, a motivating scripture, and I hung it like in my room. And like that was what I was like, if this is what you have for me, then this is what I'm going to do. And I went to my counselor, and the counselor was actually like, my grades, because again, I had fun in college. I enjoyed life. I don't regret that. But the counselor was like, your grades need a little work, and they were like, but if this is what you really want to do, you may have to take the scenic route, but you can be a doctor. And that was literally all I needed to hear was I can be a doctor. And so that is what really kept me motivated and just kept me going. I had a lot of people around me that weren't that were some were trying to do what I was doing. And as you get deeper into college, you should start to form that little group of people that all hate organic chemistry. And so we bonded. Sorry to the pharmacist and to the medical, the lab, but it's not my thing. But you form a group, and I even had people around me that didn't know or that weren't going into medicine, but still fully supported me. And so just like we've kind of like you have to find your why, even when outside noise gets loud. Um, and for me, like that again, like was a lot of prayer, a lot of this is what I'm supposed to do, nothing else. Even though I really wanted God to say, be a wonderful teacher, and I was going to go with that, but that's not it. Um, and so yeah. Um, oh, sorry, I muted myself. If anybody else instead of just calling on does anybody else have a story of a panel that they just want to go next? Feel free.
I was gonna say I'll this is coming from my wife. So my wife is an attorney. She actually does she's not practicing, but she does admissions for the College of Law at NKU, and she's always meeting with prospective students. So like I always say, I think I could actually probably train people how to take the LSAT based like I've just heard your thing over and over again. But one thing that she always says that kind of echoes what Dr. Calhoun was saying is um and sometimes your parents don't want to hear this necessarily. I've been a fly on the wall in a couple conversations where the parents did not want to hear this from my wife, but my wife will tell them, take a gap year, figure it out. Because yeah, what keeps you motivated is doing what know, as I mentioned before, I went straight through bachelor's and then I had a whole career before pharmacy, then went back into pharmacy. My bachelor's degree, I did all right, but I just was kind of fighting my parents wanting me to take over the family business and not, and kind of wanted to pave my own path, but I didn't really know what that path was. And I did all right. And I, I made it through. I got my degree. But then when I came back for pharmacy school, granted, I was older, but I knew I wanted to be a pharmacist, and that's what made me go through. So if you don't know, that's okay. Just take time, figure it out. If you want to take some classes and just kind of dip your toe into some things, that's fine. But don't feel like, oh, I got to get this bachelor's degree by the time I'm 22 or else I'm behind. I mean, I'm living proof right here. I took a 10-year excursion before I found pharmacy. So, yeah, just take your time and figure it out.
Great. Anybody
Yeah,
else? Yes, Miss
yes,
Soto.
I want to mention that, it's just to have goals. Not necessarily all the goals has to be done at the same time. I finished my bachelor degree in Puerto Rico, then I had to move here, learn English and things like that. So I'm back. So 10 years later, I'm back as an adult with two kids and a husband in a college, finishing a degree. And then I thought that I was done. And then 6 years later, I'm back in school doing a master's degree. So there's always a space and time to do everything, and it's to continue learning and pushing yourself. Not necessarily you have to do it all, from the beginning, actually my goal was to be a pharmacist, not a medical laboratory tech, but life give you put things in the middle, and then you have to find other ways or other careers that make you happy or make you more successful or depends on the situation. So it's just about continue looking for your passion, and you will find it. I think nobody else knows when it's 18 what are going to be. Right now I have my youngest is 18. He thought he's going to be an engineer. He was in UC, and suddenly he's like, Mom, I don't think I want to do this. I said, well, just go back to NKU because you're not crossing the bridge. So but it's about mini goals and setting things that you feel good with yourself, and also helping others and getting the passion, passion, or finding what do they like to do.
Wonderful. Thank you. Dr. Collins, sorry.
I was just going to piggyback off of actually a couple of things. So one, the goals thing I think is just so important because I also am a non-traditional student. Actually, after undergrad, I actually came back to Cincinnati and didn't start med school until like 8 years later. But in my mind, I'm like, okay, I know this is something that I really want to do. So one, keep that in mind. And then the people that you should lean into are the ones that support you the most. So make sure you keep them really close. Let them know like, hey, this is my progress so far. If they actually have the expertise, ask them, hey, what do I need to do for like the next step to get to the end goal? But then, we always talk about like haters, and people are like, well, what do you do if other people are discouraging you? Also kind of lean into the fact that they are discouraging you. Like for me, I remember when I went to Ohio State, there was a girl that was there the year before I started, and she was just like, there's no way anybody can get a biology degree from Ohio State. And I'm like, what's a degree? Somebody has to be getting it, so just thinking about like, no, this can be done. Like, what do I need to do? And then unfortunately, I had the advisor that was on the other end of the spectrum who really discouraged me. She's like, well, you really need to work on this and this and this. And so, medicine may not be the best thing for you, so kind of think about these other careers. I'm like, but I'm coming to you telling you, hey, I want to be a doctor. Like, what do I need to do? And so in that instance, I like kept both of those individuals in mind and was like, you know what, Armika, you got to do this now. I mean, I wanted to do it anyway, but so I just kind of found again the mentors that I needed that would tell me, hey, I need to go this way. I never saw that advisor again. I was just like, okay, she is like counterproductive to what I want to do. So just kind of lean into the support that you do have, but then those people that are discouraging you, kind of keep them in the back of your mind when you're unmotivated and being like, hey, I can prove them wrong. And
Yes.
then Dr. Calhoun, oh, sorry. I was gonna say, if I could just mention, this is totally, totally off topic, just because you mentioned LSU and I'm in my husband's office, he's over on the other side of the computer, who was like screaming. He's from New Orleans and went there for grad school. So
Well, tell him hello. And Dr. Collins, I very much too had a counselor to tell me the opposite of of that I could do the scenic route. So you will always have people along the path that don't encourage you, but I agree, use that as motivation as well. Um, a lot of people, and I think, sorry, this is going to age me like just a little bit, but he's still out there. But Jay-Z said in one of his songs, um, people are always going to tell you what they can't do, and they put that on you, but that's not you. If you want it, do it. All right, Dr. Wells, unless you had something, I was going to ask another question.
I was just going to add, the big thing is, especially in college, because college is tough. Keep your eye on the prize. It's so many times I can think back. I was like, you know what? I can just go get a job and I can just go work for, a well-known company, a Duke or a GE, and just get a good solid job and work. But I would just always come back to, and it's funny, Dr. Collins, you mentioned Dr. Crawford. And so I worked for their group when I was like 15 years old as their student file clerk. And that's when I decided, like, I'm going to be a nurse. I like how they take care of the patients. I like their rapport, their relationships. And so all through, I was like, that's what I want to do. And when I got to college, I was like, whoa. And, it's funny, somebody mentioned the scenic route. I definitely went, I call it over the river and through the woods, because when I got to UC, they were like, okay, you're going to be in the pre-nursing program to the pre-nursing program. And I was like, whoa. So, I left UC and, I just started one step at a time, went back, did my LPN, swung back around, came to UC, swung back around, worked a few years, went and did my bachelor's, worked a few years, went back for my nurse practitioner. And so I think really just keeping that eye on the prize, asking for shadows, finding you a mentor, someone that's already in the field that you can kind of, see it. It can be obtainable. You can touch it, you can feel it, you can taste it type of thing. I think that's good when you get a mentor like that. And study groups. Study groups was big. Once you got your crew, once you got out of the regular general classes, once you got into your specific classes that went to your degree, you ride out with them all the way through.
Thank you. Thank you. Okay. Another question, and I'm going to ask it a little different way for the person who asked this. So, there are specific tests to get into each field that we have. And so I am going to let the panelists talk about the entry test that they had to take to get into their particular field. Because there's different fields to get into medical school, different tests to get into medical school, to get into nursing, to get into lab, pharmacy, etc. So I will let everybody talk about their entrance exams to their particular field. And Nurse Practitioner Wells, if you want to start off.
So let's see, for nursing, getting into nursing, you had to have a certain GPA, and then you had to apply to the nursing school. You had to have certain classes, like certain sciences and things like that, and then you took an entrance exam. So that's how you got into that. As far as nurse practitioner school, you had to be a registered nurse with a bachelor's degree and I think maybe had worked as an RN for about 2 years and had a certain amount of hours. And then some schools did have a test, and some of them did require the GRE. So you just kind of decide on which school, and as far as what you have, and then kind of go from there. But yeah, from what I can remember, yeah.
And where does the NCLEX come along with that, if you don't mind just naming it? Thank
That's what it's all about. Yes. So after you do after you do all of that work, you have to sit for the state test, which is the NCLEX, as a registered nurse. And after you get done with all of your clinicals, we have clinicals, you have a certain amount of hours, you have to do clinicals in each area. So women's health, family medicine, pediatrics, and then an elective like dermatology, plastic, something like that. And each school is kind of different, but they mostly kind of, have some of the same requirements. And then you can sit once you have all your checks off, you can sit for the state exam. And then same with the NP, we have all your didactic work, and then you have your clinicals where you basically go out and kind of like it would be similar to a residency for doctors. You go and you work with a doctor or another nurse practitioner, and even sometimes a physician assistant in those particular areas for a certain amount of hours. And then after you collect all your hours, you can go sit for the state exam for nurse practitioner.
Thank you. Ms. Soto?
Yes, for the laboratory science is very similar. You have to have a GPA. You have certain amount of science class, including organic chemistry and all the other chemistries. So it is it. They're also required the 2-year degree or the 4-year degree. It will require to have some internships, and this will become to be in the laboratory settings. And then overseeing some of the different areas of the lab. You will have areas like hematology, that is about the cells. You have some about chemistry, that is some results like potassium, sodiums. Then you have the transfusion medicine or blood banking, microbiology. So there's so and so. There are many areas in the laboratory. So once you finish your didactic, your internship, then and then after that, we are take tests to be board certified, and you can be certified as a general laboratory tech, or then you can have a specialty, being maybe blood banking your specialty or things like that. And then sometimes we have other additional degree, more advanced degree depending of the specific discipline. So, but and there are different routes. Most of the time, I don't want to say the word most of the time, but historically, we have in the laboratory science, we have given priorities to the staffing that have a laboratory science degree. But now lately, because they're so short in medical technologies, especially after COVID, we then have assessed some of the requirements, to match ECLIA. There is an organization that can suggest how the education, the minimum education that we have to have. So this has opened the applicants pool, because now we can offer laboratory positions to students that has finished maybe by a chemistry degree or a biology degree, and they don't know what to do with their education. And then at this moment, then we will have to train them, educate them, and then they could sit for a board in the future, depends, of the experience and all that. But for the majority of the time, the new students come from the medical laboratory tech degree or the 4 years medical technologies, and then they take their board.
Thank you. And Dr. Collins, and the question did specifically ask about the MCAT.
It did ask about the MCAT, the dreaded MCAT. So, so MCAT is the medical college admission test. And so to get in medical school, I think the GPA is definitely important. I would say at least a 3.5 or higher. And then of course you have to take all the prerequisite courses that they want you to take. So different, we talked about like the organic chemistry, there's different physics classes, math classes that you have to take. And so you need to take all of those so that you can actually take the MCAT, because you need that information to take the MCAT. And so the MCAT, you take it, usually it depends on when you're about to start medical school, but a lot of people will take it in their junior year in college. It's an exam where you're there pretty much all day. It's like 7 to 8 hour exam. Split up in different sections. I took it so long ago, I don't even know the sections now. I know it's definitely changed since the last time I took it.
It has changed. It has
Yeah. So I'm like, I can't even speak to what it looks like nowadays, but just know it's a long exam, and all those classes that you take in college are, pretty much for you to take the MCAT to get in. And the same for scoring. The scoring is so much different. So that's kind of it with the MCAT. I don't know, Dr. Calhoun, if you have anything else to add, but that's to get in.
Yeah, no, that was the question specifically. Yeah, so everyone has to take the MCAT if you want to go into medical school. I know sometimes people are confused. Medical school and nursing school are different. So, this is only if you want to be a doctor, do you take the MCAT? And it's don't give up.
Right, exactly. It's something you have to do.
Yes, it's something you have to do. Exactly. All right. And if you want to talk about pharmacy.
So for pharmacy, so it depends on the college of pharmacy. I think there are some schools left that really you can get all your prerequisites done in 2 years without without a bachelor's degree. The thing about that is that you still get held to like all the general electives. And then you have to do that during pharmacy school. So, it seems like more schools are moving toward the bachelor, just requiring a bachelor's degree. I think UC's splitting the difference, so um, you can get in with 3 years. But just like everybody else has mentioned, you got your sciences, math courses, etc. We have the PCAT. I from the descriptions, similarly long, awful test. Um, my experience was that since I had been out of school for so long, I was having to relearn some subjects that I forgot I had even learned in the first place. And the interesting thing about the PCAT is pharmacy admissions always kind of put an asterisk next to it because I guess they had more variability as to what was on the PCAT. So I just distinctly remember one of the admissions folks at one point, like overhearing a conversation, they were like, oh yeah, the PCAT scores were awful because they just pulled trigonometry out of nowhere and just hammered them with trigonometry. Um, so the PCAT's actually been like it's important that you take the P you have to take the PCAT. You got to try to do as well as possible. But they put an asterisk next to it. They will compare your scores with how everybody else did in that offering of the PCAT because evidently they'll just decide we're going to test you on this random topic and everybody does poorly. So if that's the case, your lower score may not actually be as bad as you might think. GPA definitely important. Um, I'll say this much because I did help out with admissions for a little bit. Um, Everybody, whether it's nursing, lab work, medical school, pharmacy, everybody's going to be pretty good at math, pretty good at science. Everybody's probably going to have a pretty decent GPA. Everybody's trying to get an entry exam score that's really respectable. So don't forget about all your other stuff that makes you a complete candidate. Um, One big thing is kind of look at what if you're looking at pharmacy school, but I'm sure medical school, nursing school are kind of the same. Look at what the emphasis is at that school. So, one big thing, like, so you see one thing that sets it apart is they're really big into, um, being a part of the community. And so they really put a high emphasis on what leadership things were you involved with, what community, uh, community service activities were you involved with? Those are the things that set you apart from other candidates who are also going to have a good GPA, good PCAT score. But then research, because some colleges of pharmacy are like big research centers. So maybe if you have a little research as an undergrad, that's going to set you apart. So those are definitely the big things to look out for pharmacy. And then I'm sorry if I don't know if you wanted to talk about once you're out of pharmacy school, we have a NAPLEX, and then we have the NAPLEX is, I like to call it, make sure you don't kill anybody test. So do you know how to do pharmacy calculations? Do you know how to dose drugs? Do you know side effects, that sort of thing? It is a long and grueling test. And you will walk out of there thinking you failed and somehow miraculously don't do half bad. Um, the interesting thing about pharmacy is that you take the NAPLEX once and you're good to go. Every time you want to get a state license, you have to take a law exam for that state. Because if you think about it, especially when you're dispensing drugs, you're that last point of contact before you put a drug in a person's hand. So you actually have to be familiar with not only federal law, but state law. And I have I have the three tri-state licenses, and it's pretty amazing how, for instance, Ohio and Kentucky are very similar as far as what they emphasize as far as law. But then I guess in Indiana, pharmacists in Indiana are able to help with of all things, um, like veterinary euthanasia, like medications. So like I had to cram veterinary euthanasia laws like in the parking lot of the test center before I went in. So and I've heard California is, if you want to move to California, it is an insanely difficult test. They just have tons of regulations there. So that is one. I'm not sure if it's the same for medicine or for nursing, but that is one thing about pharmacy is that for every license, you need to take a law exam.
Yeah, no, that's different. And we didn't get into like for medicine, you will basically test for the rest of your career.
Yeah.
But I don't want to scare anybody because I know we have a lot of high school students, but it's constant learning. And so the MCAT is just the start of it. And the other part of the question was how do we study for it? I would say there's different ways to study for any test. There are classes that you can take, like Kaplan Review. What is it? Kaplan, Princeton. So you can sit in classrooms and do that. You can study on your own, like you can buy the books and study on your own. There are a lot of practice tests like out there that you can buy online. So you just kind of have to pick how you study best. So it's hard for us to kind of say like what really works. I know different people study different ways, and because we have gotten so good at studying in medicine, once you figure out how you study, you just do that for the rest of your career. So, and that's with everything. Um, I want to get to a question, and not necessarily everybody has to answer, especially if yours is kind of similar. But a question that was submitted prior is financial aid. Um, what type of financial aid did you use, if any, and did you have any challenges obtaining financial aid? So I'll just let someone, if anybody wanted to go and answer that.
I will quickly just answer. Only it's a challenge that I didn't have, but I know that a lot of medical students run into. So I went with just like straight 100% like government loans for medical school. But the thing is, in medical school, you have to actually submit your parents' information. And so I think that took a lot of students by surprise. Just because people think like, oh, okay, I know in other graduate programs you don't have to submit parents' information, but you literally have to either show that they are deceased, or I don't even know how otherwise people actually get out of like not showing their parents' information for that. But I know that was a challenge. So
Yeah, there are a lot of different ways. To and I don't know if anybody on the call did like the armed forces. So some people in my class did like the Air Force or the Army, so did a little time with that. There are scholarships that you can obtain, especially um, in medicine, where if you go into a primary care job, then you can get like your medical school paid for if after school you go into that particular field. So there are different options from that standpoint. Did anybody else have anything else to add that they maybe use that? Um,
Not necessarily anything different that I use, but I will throw out there because my wife is about to hit this unicorn. So if you get government loans and you work for a nonprofit organization for 10 years and make 10 years worth of payments, they will forgive your federal loans. And my wife has been working and making payments for 10 years for her government loans. And we check it every day. It's making its way through the process, but she's about to have all her student loans forgiven. So once you graduate, definitely consider working for a nonprofit because that is a real thing that's out there.
I agree. We do have limited time, and I don't want to go over time. We just have 15 minutes left. So I'm sorry if I wasn't able to get to your question. I will answer one quick question that someone asked about medicine in particular and dealing with death. Um, I, being a hospitalist, do have to deal with people who pass away in the hospital. I'm a pediatrician, so deal with children only, but children tend to do well, but they do pass away. The question was if I ever have to decide if someone dies, and I never think of it that way because if I put myself in it and say that it's never me. It's never me. I do the best I can to the best of my ability, but whether I'm deciding if someone passed away, that's up to whatever higher being you believe in. And so to help me get through my day when things do go wrong, it's not me that ever makes that choice. But medicine is definitely hard. And I know other people on the call deal with adults. But I'll just touch on that and say, that's something we don't necessarily like to think about, but life and death does happen in the hospital and everything in between. But I know we all try to do our best to have the healthiest patients in all realms. And so, yeah. And then now we'll ask the last question that I would say, hold on, let me just make sure. Um, and there is a question about TAP, and I'll let Miss McKinney do that at the very end. So we will get to that. Um, and you guys can answer and kind of mix this. If you could go back and change anything about what you're doing, what would you change? Um, and or if you would like to, how do you kind of keep a work-life balance, which I think we kind of answered that. So I'll go with the first one. If you could go back and change anything about your career, about your field, about what you've done, would you and what would you change? We'll start with Nurse Practitioner Wells. I know you're always on the spot first. Sorry.
Yeah, so I just wanted to quickly go back to the death question. Just really quickly, I worked in the surgical and trauma ICU for many years, about 10 years as a registered nurse. So I dealt with tons and tons of death. But it's interesting in medicine, you'll learn too about different code statuses and if people are full codes and if people are not, or what their wishes are, if they wish to not be saved. And so the good thing and the positive thing that came out of that is I was often able to assist and comfort the family during some of those times. So just providing care to the families as well as the patient in those last stages. So that was a positive thing. So it wasn't all negative. And then I also did organ procurement, which is a whole nother ball game. Um, and that was interesting too, where you're basically, let's see, what's the best way to say it? You are you are someone that may be dying. They have offered to give their organs to somebody else that could use them. And so you are caring for them and their family as well through the transition. So it is some positive things around death, which is kind of interesting. Okay, so tell me the question again.
If you could change anything, what would it be and why? If you could change anything.
I don't think that I really would change anything. I mean, I am so happy with the different things. I definitely went into family medicine, coming off of being in the ICU for so long and the extreme of everything. And I wanted to go into family so that I could really just start tapping into the whole person. So now I can do women's health. One day I may be doing pap smears all day. Another day I may be helping somebody with their blood pressure. Another day I may be consulting a small nonprofit on, health screening programs. Another day I may be doing lip filler and, Botox. And so I don't think I would change a thing. I absolutely love it and I can do whatever that I want to do with it.
Love it. Miss Soto?
I don't know. Every step in my career, it was so important and it was so different and it was like a zigzag line that I don't know if I even could have repeated again. But it was really important and I know I would maybe select another career in the healthcare field. But I'm really happy of where I am right now, and it's probably I would make the ride, the same, and I will take the same path to where I am today.
Thank you. Dr. Collins?
Okay. Ultimately, I think I would still like take the same path. But Dr. Llambi talked about it earlier and talked about like physician burnout. And so one of the things that I really learned in residency, which residency are the years that you do after medical school and like you get more training in the specialty that you actually want to be in. I realized that even residents are like exceptionally burned out. And so I would have focused on wellness like a little earlier because for me, it was really, really hard to see some of my co-residents like struggling in residency and not like really taking good care of themselves. So I kind of realized that at the very end, and actually I'm doing like a wellness program through like the American Academy of Family Practice. But I probably would have just done that earlier with the hopes that maybe it could have helped some of my co-residents and myself, even like towards the end of residency, where you are really stretching yourself to the limit, when it comes to hours and again, seeing coworkers and the things that happen in medicine are kind of tough. So just from a wellness perspective.
Dr. Yambia?
Yeah, I don't know that I would change anything. When I was graduating pharmacy school, I kind of had the option to go more community pharmacy, ambulatory care, and then I had another residency that I really enjoyed the clinical rotation. And it was actually for psychiatry, which is one of my passions, but kind of echoing what nurse practitioner Wells said, primary care, family medicine, you get a little bit of everything, and that's what I really like. So I'm glad that I did not overly specialize, and so I can see it all in primary care.
Wonderful. And I'm just going to echo, I wouldn't change anything. I took the scenic route. I didn't go straight through, but looking back, I see why. I understand why. I love it. I have learned so much about myself, about others, about medicine, and it led me here. So I'm grateful, and I wouldn't change a thing. All right. Well, from our panelists, I want to say thank you so much. This has been fun, for me, just to getting to know everybody, especially around Cincinnati. I think sometimes we get so caught up in our little, or I can speak for me, I get so caught up in my little silo. So it's very nice to meet other people outside of Cincinnati Children's, and in different fields and doing different things. So thank you, Miss McKinney, for bringing us together and with the Health Collaborative. And I'll let you get the last question, about, there was one about how long is a TAP health program and when does it take place? So I think that's a good ending. So thank you guys so much.
Thank you. You were fantastic. I really enjoyed this. I enjoyed all of you panelists. You were so great. Thank you so much, Dr. Calhoun. I just really, the questions were so interesting too. So thank you to everyone who asked them or submitted them beforehand. This was fantastic. And we're just really excited to have this recorded because this was such a good event. As for the TAP Health program, it runs in June and July. The applications are open now all the way through March 5th. And when the program runs, even though it's June and July, it is not every day. For one, we we don't have events this year on Fridays, and there's going to be other days every week that we don't have events. There's also a couple weeks that we completely have none. So you don't have to feel like you have to give us your entire June and July. And also, there's really 3 programs within it. So if you're more interested in the nursing track, we have that. We also have the more physician track, and then we have healthcare general. So we try to divide the events up like that. But last year, we had students who were in one track who attended events in all 3. So it's definitely something that you can do as much or as little as you'd like. And if you ask that question, you probably already have the website, but I'll go ahead and drop that in the chat. It has information on how to apply, but it's a really awesome program. I know there's actually at least one student from last year's program who was on the call today. I noticed her. So I try to find opportunities for you all year round, even beyond the summer. And so that's another good reason to be in the program, is that you get connected to the Health Collaborative and to our contacts as much as possible. We also try to set you up with mentorship opportunities or shadowing opportunities if you want them in certain fields. So it's a good program, and I hope you do apply. If you have any other questions, I'm also going to drop my email in the chat, and you can feel free to email me, and I will get back to you as soon as I can. So I don't know if anyone else, Nikki, if you had anything to say, or if anyone else want to say anything else, or
Yeah, any other panelists? I'm also going to drop at Cincinnati Children's, one of my jobs is also I'm a program director for the high school summer internship at Cincinnati Children's. As soon as I realize how to put things in the chat for everyone to see, I'll put it in the chat, and then just the website. So you guys, the application is due February 1st. So please hurry, but we would like as many of you on the call who are seniors right now in high school to please apply.
I
But
will just echo Helena's thanks to all of our panelists. Thank you so much. This was great, very informative, and thank you for the students who showed up tonight as well. I hope you all got something from it, and have a good evening.
all right.
thank you guys so much. Thank you.
Thanks. Bye.